we're going to break down, what an EOB is, what you get in mail for the beneficiaries out there, because they are bombarded by mail, and a lot of times all that EOB letter looks like Greek to you. So stick around. I realize that you're looking at a lot of mail and solicitations right now, but if you want to know the path that you're on in Medicare, this is a really important video for you to listen to. So I hope you guys get some value out of it, and please hit us back in the comment section, like, subscribe, all that stuff. Thanks so much. All right, so I have Bonnie Flom. Did I pronounce it correct?
You did.
From Billing Buddies, and I believe you're in Minnesota. Is that correct?
That's correct. Suburb of Minneapolis.
All right, Billing Buddies does what as a service?
We're a medical billing service that provides billing for all kinds of specialties. We have a lot of mental health providers and chiropractic, speech pathologists, audiologists, a wide variety.
Yeah, yeah. And I actually found you on YouTube, and now we're doing a collaboration together to, disseminate some maybe and demystify some information about medical billing, which I think is going to help not only providers out there that actually need it, but also help the medical community, the Medicare community that I'm a part of. And so I really appreciate your time and coming to do this interview with us. And so I wanted to surprise you really quick. So I've had this idea a long time to do a Medicare live, Medicare, interview style, videos and stuff. And I noticed you did obviously a video on YouTube before, but I wanted to do something to where it was very pervasive and it helped a lot of people out there, especially when it comes to like the misinformation and confusion that happens when using your your healthcare insurance. And so that happens a lot in the Medicare space, as you might well know. So,
Yes.
but yeah, this is going to be, Medicare Live episode 1.2, if you will, because of the pandemic and all that stuff. So I really appreciate you being kind of our first guest during all this. But yeah, if you're watching this and, you want to know more about medical billing as a provider, please stay tuned, because Bonnie is going to just do a quick overview on, some topics that she does to help providers, because it is a service that she does throughout all 50 states, which is why I wanted to speak with her, because she had so much insight and knowledge about the industry, and it's in all 50 states, and there's plenty of providers out there that need help, right, Bonnie?
That's true. So true. And it keeps growing with the complexity of the field.
That's a good, yeah, that's a good word, complexity. There's definitely some complexity, especially on the billing side, and in our space in Medicare, there's definitely some complexity and confusion, right?
Definitely.
Yeah, yeah. So if you're a provider, stick around. But guess what? If you are a Medicare beneficiary, my name's Mike at Medicare Savings down here in Charleston, South Carolina, and we help beneficiaries navigate the Medicare space, especially when they're looking into their Medicare insurance options. And we try to make that a straightforward process, even though you're bombarded by so many solicitations and mail. We make that very simple and easy for the folks out there, especially the retirees that they just get bombarded every which way, and they just don't know exactly the straightforward path. So if you're a provider, if you're a beneficiary, stick around. We're going to talk about medical billing and try to make it straightforward, easy for you to understand, and not have all this either Medicare speak or billing speak into it. And if we do, we're going to break it down for you. So stick around. All right, pause for that. good. And then we'll just pause real quick. All right, good. All right, and then Bonnie, we're gonna get into the questions here. All right, hold on one second.
Now, are you in all 50 states? Can you help any Medicare?
Yeah, I'm partnered with Medicare Back Office, so we can do all 50. Yeah.
Oh, cool.
Yeah, we can do
I
all
might
50.
pick your brain for my husband's Part C when open enrollment starts.
Yeah, it's starting. It's starting really soon. Yeah, yeah. And
What
you can pick. I mean, if we get to those questions, you can pick my brain during this interview process because it's going to be back and forth, like you said. You know.
what day does open enrollment start for Medicare beneficiaries?
Oh, save that question. Okay, I'm gonna feed you a Medicare thing, and then you ask that on the interview. Okay.
Do you know
It's the
the
15th.
deductible amount for 2022?
It comes out in November. The Part B deductible, annual deductible. No,
Yes.
it's gonna come out in early November. That's typically when they announce it. Yeah, so they don't have it out yet. So
Okay.
yeah, and we might have to do another one with that, so that way we can talk about it. All right, that's cool. Okay, hold on one second. All right, okay, reset. We're good to go. All right. All right, guys, we are back. Thanks for hold on, let me redo that. All right, all right, guys, we're back with Bonnie here, and we're gonna speak about some provider topics really quickly. So stay tuned. If you're a beneficiary, this will help you out as well, just to know where they're coming from, and also too, being a smart Medicare consumer, a person that actually knows the process, will help you with any headaches in the future, right, Bonnie?
Oh, definitely.
Yeah, because medical billing is the backbone of claims payment, of who's the first payer, who's the second payer, and we'll get into all that as well. But I want Bonnie to demystify some things for the provider side. So stay tuned. Hopefully, it's interesting to you. So Bonnie, so we're coming from billing. We're coming to you, Billing Buddies in Minnesota, and we're trying to just bring light to billing topics for providers on these first questions here. So let's just go into the basic definition. What is medical billing for providers?
Medical billing is where we collect the money for the doctors and the providers for the services they provide.
Mm-hmm.
And it's pretty simple. There's
Yeah.
three things we need to be able to do billing. We need the patient information, or demographics they're called. The providers or doctors' charges. Charges are for services that you, the beneficiary, received or the doctor rendered.
Right.
And then we need the payment, or it's called adjudication information, on how the insurance process the claims for the providers. And we put that all in the system, and there's many types of software out there that people use. We happen to like Office Ally and Procentive, and but really any software for billing agencies can accommodate these types of services.
Great. So, from the provider side, I want you guys to just listen in real quick for with Bonnie, because I spoke with her at length about how much experience she has. And Bonnie, I know you don't have to go into it with the whole conversation we had last time, but just let people know where you're coming from when you talk about your medical billing experience. How your process, your journey into it, because it was really interesting for us to talk about it.
Yes, I was really fortunate, and I started working at a hospital when I was 18, and I worked in the billing department from 84 to 94. So you can figure my age, I'm 56.
That's right.
And it was a wonderful experience working for this hospital, because I got to learn different types of billings for all kinds of specialties. and that really helped me start my business in 1994. And since 1994, I've had my own medical billing company. I'm a member of the American Medical Billing Association,
Hmm.
and I'm a certified medical reimbursement specialist and
Mm.
a certified coding Medicare specialist. And I maintain that certification every year by getting CEUs.
Hmm.
I've also served on the Medicare Provider Education and Training Committee, and I've served on the Blue Cross EDI Committee. Um, and
Okay.
also, the Minnesota Chiropractic Association has me serve with DHS on their coding committee.
Okay. Alrighty. So you have some experience. Oh man, I wish people could hear and listen to the conversation we had last time, because I was so blown away by your not just experience but your heart actually, because of how you're helping people and how you've been an entrepreneur your whole life, and just using your gifts and abilities to just touch more people in especially in this billing provider space. It's just definitely something where you don't think about medical billing day to day, but it's a big part of your life when you do use it, right? So
It's a driving passion for me. It's a field that I've really taken to
yeah,
and really enjoy.
yeah. Well, we can definitely tell. Even if I am multiple states away from you, I could tell right away from your YouTube interview before. But so back to the providers and how how you're able to service them, and the type of ways you're able to service them. So it's pretty straightforward. Like you said, you just need some basic information to tie it all in and file the claim. Now that's the part where the providers, they're healthcare professionals. They don't deal with the administrative work uh, of uh, of submitting the claim. Is that correct, or am I making an assumption?
No, you're right on, Mike. That's exactly right. The providers give us that data
Yeah.
either by us logging into their software and getting it,
Yeah.
or some people are still not utilizing software and they just
Really?
fax us. Right, I know.
Wow.
Scan. Um, some people actually send papers still
No
to
way.
get the demographics and charges and payment information.
Right. Okay. All right. So, when medical providers, I mean, I think the industry is just keeps expanding and growing, right? You've expanded to 50 states. I mean, what do you think about the industry as a whole for the medical billing? Does it,
I think medical billing has gone to where tax consulting
mm,
has been. Is
okay.
it's changing constantly, and you need an expert to stay on top of the changes.
Yeah.
Um, just like in taxes and
Or in Medicare.
their Medicare, exactly. One thing I always think about Medicare beneficiaries when I'm billing is I think that Medicare beneficiaries will sometimes get confused because they might go, for example, to the hospital to have a colonoscopy,
Mm-hmm.
and they're going to get a bill from the hospital
Yeah.
and they're going to get a bill from the doctor and sometimes the anesthesiologist,
Yep.
depending upon and to put that all together and understand why they're getting all the paperwork in the mail
Yeah.
is
Yeah.
really important.
Yeah, yeah. We're just putting a little teaser in there for you beneficiaries, because I know you guys want to know about your EOBs. We're gonna talk about that, but just stay tuned, because we're gonna try to make sure that we help both sides, because it really is a community of people that are trying to help you on your if you're a beneficiary, your Medicare journey, if you're somebody that's utilizing your medical services, then we want to help you too, because the U.S. healthcare system is so big and complex that the billing part is pretty much the most important, because that's who pays the actual bills, right? And then who needs, and people, either the provider or the patient needs to know who's paying, right?
Yes,
Yeah,
definitely.
yeah.
And both of the parties receive explanation of benefits.
Okay.
The provider does and the beneficiary
I did not know
does.
that. I did not know that.
Yes. So, and they match. So when a beneficiary receives a statement in the mail from a clinic or a hospital, they should have an explanation of benefits to match with that
Hmm.
statement that says they owe the same amount
Yeah.
that the clinic or hospital or provider is billing for.
Right. Right. Yeah.
I
Yeah. Cause
wanted
okay.
to
Go ahead.
interject, when we do billing, the money for the doctors or clinics, hospitals still go back to the clinic and hospital. We do not collect money. We bill for it and they pay the provider
Hmm.
and we record the payment.
Okay.
And then we bill the beneficiary or the patient and they pay the provider and we record it.
Okay. Now, how has Billing Buddies? This is just, I guess, just a curiosity. How have you been able to scale to 50 states and offer just your Billing Buddies brand to more and more providers? Is it something where you just make the process easier, even though it has some complexity, or?
Um, What's really nice about Medicare is they have carriers, they're
Mhm.
in MACs, they're called,
Mhm.
that come up with policies and procedures. So, for example, if I was going to do billing in South Carolina, I would look up the Medicare carrier for South Carolina
Mhm.
and the specialty for the provider I'm billing for, say a chiropractic or a mental health provider. And it gives all the rules and regulations in those policies. So it's fairly easy to adapt to different states in
Markets.
billing.
Okay. Okay. That's really cool to know. So you guys have it to where you've been doing it a long time, and you obviously know the process to make it easy for you billing buddies to be able to service any provider in any state. So that's really cool. That's really cool. I didn't think. I mean, I don't know if I have misconceptions or I just don't understand the whole billing industry. It's just that, I thought you'd have to be, are you have to be certified for each state, or how does that work for billing?
Currently, there isn't any certifications required to
Okay.
do billing,
Yeah.
which is important when you're looking for a biller to see what kind of certifications and training they have
Yeah.
and what kind of continuing education they take.
Yeah.
So, for a provider looking for a billing specialist, they really want to ask those questions
Okay.
and find out what kind of certification the biller has.
Yeah. And how I guess I want to ask, like, how, how long have some of your provider clients been with you?
Oh, I've had clients that for 15, 20 years. Yeah.
Longer than I've been in Medicare, but that's that's a good answer. That's cool. Yeah, yeah, that's awesome. I mean, we've had clients like beneficiaries that I think our oldest client was 94 when we first helped her save some money. So she's older than that now. So I don't know her exact age, but yeah. So providers have been with you, not just in the beginning, but you kind of build a relationship with them, just like we do with beneficiaries. Is that, hey, we are a service, and you could shop around for other services, but now we know what we're doing. We make it simple and we make it easy on your office, right?
That's true, and I think what you're offering to beneficiaries is really important because they need a person in between the insurance carrier in themselves to kind of interpret what's being done
Yeah.
as far as getting policies
Yeah. Yeah.
and procedures
Yeah.
involved.
And I like to help out, but the objection or the maybe just the question in the beneficiary's mind is that what's this person? Why is he helping me out? Why is he helping me out for free? And a lot of times they don't see you on, now that a lot of things are remote, they don't see you face to face. They don't know your life. They don't know your your desire to help people. But that's why if we do more of these together, Bonnie, I think we'll flesh out some people out there that might need our help, because we really do want to give the straightforward and easy information when it comes to medical billing for providers and the beneficiaries, because it has to be on a level playing field where everybody can understand it. When you go over some of these, the Medicare and You handbook, I have not had one beneficiary come up to me and be like, "I read that thing cover to cover." That's just not going to happen. If you want to read it, it's like bedtime reading. It'll put you to sleep at night. but
Yes.
but yeah. So just to finish off the for the medical providers out there, or for the providers out there that need medical billing, what should they be looking for? From a billing specialist, from a billing service like Billing Buddies. Even if they don't choose you, what are the things that they are looking for? Should be looking for?
One thing that's important for providers is they can have access at any time to their data.
Mm-hmm.
So the billing agency should be able to give the provider access so they can see what's happening with their account.
Mm-hmm.
Another important part, especially with Medicare, is providers need to enroll in Medicare. And that's a big step for many providers. So they can't be reimbursed until they're enrolled in Medicare.
Yeah, yeah. And if we can, let's break that down real quick, because I've actually been listening to other YouTube medical professional YouTubers talk about CMS. And so CMS is the Centers for Medicare and Medicaid. They're the governing administrator over both programs, right? So let's talk about specifically Medicare, because might get into Medicaid later, but the Medicare program. So how does that look like for a provider? How does that look like for the billing service?
I think an important note is CMS is the government agency that administers the Medicare program, but under CMS are private companies.
Yeah.
Like Meridian and National Government Services.
Right. Yep.
And they all carry out the rules of CMS.
Right.
And there's different carriers in each state that do that. So people think of Medicare all clumped together as one place, like you bill Medicare. But in reality, the billing agencies aren't billing Medicare, they're billing the private companies on behalf of the provider, and they're adjudicating the claims or settling the claims.
Right.
Based upon the CMS guidelines.
And so I believe those are called MACs, correct?
You're right.
Yeah. So
Medicare administrative carriers.
Right. So they have jurisdiction. So one MAC will be jurisdiction for let's just say for all intents and purposes, like the Southeast or the Midwest, West Coast, and there's like 3 or 5 of them, something like that, right? Three or four MACs, something like that.
That's correct. I don't know the exact number, but it's a handful, and it's
and they're gigantic.
Yeah.
Yeah. Thank you for demystifying that a little bit and breaking that down, because that's just something that I have been getting into on, I guess, nerding out on. I'm like, okay, what are these MACs about? How do they help? And so when the providers are or the billing services are when the billing services are sending in the information to the MACs, they're paying out the claim. They're looking over it and paying out the claims. Now that sounds like a not so straightforward process, but from let's just speak about from an example like a provider has a Medicare beneficiary as a client, and they're servicing them, right? And so after the medical services have been provided, they send the information to you, or you get the information through software, right? And then you do what from there? What does that process look like there?
Well, the initial setup we need to do with the providers is they need to be enrolled in Medicare.
Enrolled, okay.
And then we set up the software, and there's something called a clearinghouse. In a clearinghouse, I always compare to the Postal Service. So we enroll the provider to send the claims, their charges, to the clearinghouse. And the clearinghouse then distributes them to the carriers to process the claims. And after the carriers distribute and process the claims, they send the explanation of benefits and the payment information back to the clearinghouse and then to the billing company. So it's similar, like if you wanted to deliver letters on your own, you could go to each place and deliver them, or you could use the post office to distribute them.
Yeah.
The clearinghouse is very similar. We can batch all of our claims, send it to one place, and they send it off to the appropriate insurance company.
All right, this is really important, what she just said, for both the providers and any beneficiaries or anyone that has medical claims right now. So it is a streamlined process. Else, if it wasn't a streamlined process, there would be all this, confusion with medical billing. So when you're dealing with somebody who's a Medicare beneficiary and they're on traditional Medicare A and B as their primary health insurance, then they're billing directly to MAC, or they're billing directly to CMS through one of their MACs, and then from there they decide on paying the claim under what's covered under A and B. Is that correct?
That's exactly right.
Okay, so that is a little bit into the weeds and nerdy, I know, if you're listening, but I want to touch on this because not only is this super important for the providers on how they get paid, because they are going to get paid the fastest, just from what I've heard and what I've looked into, when they're billing traditional Medicare. Am I correct on that, or is that incorrect?
Medicare pays in 21 days typically.
Yeah.
And insurance companies have 30 days to process, pay, or deny a claim. And so Medicare is a little bit quicker at reimbursing.
Right. And not only are they faster, but also too, when they're billing, or when you're billing for them to Medicare, then is it to where is it easier for the provider? With insurance companies, there's layers of not just protection, but just layers of kind of auditing, like prior authorization. Well, you don't have prior authorization with traditional Medicare. That makes it an easier process to bill, correct?
True.
Okay.
That's true.
Okay, good. This is really important because I think it's just a misconception out there that every pathway, all you're doing is just picking out brands and companies out there that offer you the most benefit. But really, when it comes down to claims payment, when it comes down to the provider wanting to be paid for their services in a timely manner and wanting a system that actually is in place for them. Like, how many providers are on that bill with CMS? Do you know?
I don't. That would be a very interesting
Yeah,
topic to research.
yeah, yeah. I saw some of the stats out there. I think there's over 1 million providers that accept assignment, which means they accept full payment from Medicare. So that's
Yes.
just makes it a hassle-free thing for, say, your primary care physician accepts assignment from Medicare. They do use a billing service like Billing Buddies. You send it out, they get paid 21 days, and then boom, the process is over. You get an EOB saying everything was fully paid. Is that correct?
That's correct. After the deductible and coinsurance,
Yeah,
the beneficiary always has their portion that's due.
yeah,
One thing that makes it easier with Medicare is they have really solid policies and procedures.
yeah,
And
yeah,
when you switch to some of the Advantage plans, those are the plans that beneficiaries can opt into. The doctor then needs to contract with each of those plans too.
yeah,
And that adds to the complexity of billing because um, if they're not in network with their plan, it causes delays and problems.
Oh, you're preaching to the choir. You're
Mhm.
preaching to the choir. But I hope this information is definitely helping out the providers, because, you guys are doing such a awesome job with COVID and handling patients, and just knowing that, you are, you're just trying to fulfill services through this insurance-based system that we have in the U.S. And look, the Medicare program, I believe it helps. Medicare and Medicaid has helped millions of Americans for 56 plus years. And so it gets a lot of bad reputation. But man, I mean, how many people on Medicare use their services day in, every day, especially with chronic conditions. I mean, I'm going to get off my rant here, but uh, I just think that, the more people are educated on what goes on behind the scenes, the more that they can be, maybe compassionate or have a little bit of grace when they get a big bill in the mail and they just don't understand what's going on. And I think that's where people need to be met, is to understand what's going on in the when they get a bill, or when the provider doesn't have anything match up. So, but hey guys, we're going to transition to the questions specifically for beneficiaries. The providers, you guys, if you're looking for somebody that's has tons of experience and you're maybe new to the provider space, Billing Buddies, I mean, I just keep on I keep on listening to her, and she's just giving out more and more information that I never knew about. So hopefully it's helping you. So for the Medicare beneficiaries out there, they get these EOBs, explanation of benefits, in the mail that looks like Greek to them. I look at it and I'm just like, I'm reviewing it with clients sometimes, and I'm dumbfounded as well. So, like, explain to us why people get EOBs for their medical services, or other, maybe other things. But what is an EOB?
Yes, an EOB, otherwise known as explanation of benefits, is a form the insurance companies or Medicare send the beneficiary. It's kind of a stopgap safety measure because the beneficiary needs to be aware that a provider is getting paid under their benefits.
Mm-hmm.
And if Medicare or insurance companies didn't send out explanation of benefits, fraud would be more prevalent because
Oh,
that's where beneficiaries can catch, that, hey, I wasn't at this clinic on this date.
right.
And so they're using that as a safety measure to include the beneficiary in getting those explanation of benefits. And there's really, when you get that form, it's really confusing sometimes. A lot of times it'll say this is not a bill. So they're not looking at the beneficiary to paying Medicare or who's sending it. What they're doing is explaining to the beneficiary that we have a bill for this provider on this date of service for this service for in dollar amount. And it will say on the beneficiary's explanation of benefits what they owe to that provider. And that should match up with the statement the beneficiary is getting from the provider. So if the beneficiary takes the time to look at that, there shouldn't be any surprise bills. And typically the beneficiary receives their copy before the provider receives their copy.
Interesting. Wow. That was probably the best explanation of of EOB that I've heard, because I just look at it, and if you don't have any background in medical billing, if you don't have any background in just looking at that stuff day in and day out, it just looks like all Greek, right? You see the big bold number at the top. Hey, this back surgery was $32,000. This cancer treatment was $100,000. I mean, big numbers are on those EOBs, right? Like
Yes.
pretty big numbers. But the thing about it is, like, you're getting that to try to discern what's happening in the process, but there's nobody there to explain the EOBs, and that's I think where we're gonna have to flesh out a little bit more on maybe later episodes that I'm gonna tie you down to right now. But no, it really is. It's like you see a big number and then fear comes into play, right? So
One thing to know about that number, like you 30,000 for surgery or 100,000 for cancer, is the provider is typically not getting that money, that whole money.
Right.
CMS, or Centers for Medicare and Medicaid Services, has what's called a fee schedule, what they'll pay for each service.
Right.
So even though you're billing 30,000, it'll say what's allowed, maybe 24,000. So the provider needs to write off that $6,000 difference. And then it'll show what the patient's responsibility is, their deductible and co-insurance, and what their part is in that bill. So that big number, I think providers sometimes get a bad rap that this is what they're getting paid, and they're really not. They're taking a hit and an adjustment that they have to write off with their contract with Medicare.
Right. But I think for the beneficiary, and I know we could go off on all types of tangents with this one topic alone, but I think for the beneficiary, it's very confusing. If someone like me, and I'm looking at it and I'm just on the insurance side, I don't see these medical bills every single day, and so sometimes I get these questions and everything, and typically I'm like, hey, did you pay the annual deductible yet? That's probably why you're getting it at a bill at the beginning of the year, and people are always if they don't know that that resets every single year, the deductible, then they're going to have questions. So I guess for the beneficiary, how should they view the EOB? I mean, we don't have one in front of us right now, and we'll probably do a deeper dive and breakdown on it later on, but how should they view the EOB, and what are some simple tips or steps that they can do to just figure out if it is a bill or not?
That's a great question. One of the first things they need to look at is it'll tell who the provider of service is, and that will help the beneficiary know if they've been to that clinic or seen that provider. What's confusing with that is they may have been at the hospital and had surgery, and they're getting a bill from the anesthesiologist, and that name may not be familiar to
Mm-hmm.
the patient, or they're getting a bill from the lab or the
Mm-hmm.
pathology. And what they really should look at is the date of service on the EOB. And it would be helpful if the beneficiary kind of kept a mini calendar about when they were at each clinic
Mm-hmm.
or had professional services rendered,
Mm-hmm.
because that date on there should match their date of service when
Right.
they receive services. And
Right.
then the last thing to look at is what is their responsibility on that
Right.
explanation benefits.
Right. Right. And I think that's where it gets down to, is that you see these big numbers on EOBs, you go through your checkpoints there, and then ultimately, am I responsible for a deductible? Am I responsible for any co-payments or co-insurance or anything like that? And that's where where you talk to your agent, your insurance agent, your insurance brokerage agency, whatever, and make sure, hopefully in the beginning of the process of choosing your health services, you want to choose something that is in line with how the bills are being paid and being met. And so that's where I think insurance gets a lot of bad rap, is that they didn't pay my bill, they didn't pay the full bill. I'm like, well, that's not how insurance works. It works off risks. It works off you, the policyholder, having some stake in the game, because nothing in this world is free, even though it's marketed as such, and that's a whole different topic, right?
Right.
To where Medicare plans are free and all this and that, and it's not free when you go to use some major services or anything like that, right? So, um,
Um,
yeah, go ahead.
I'd like to interject. The term deductible, some people are confused by what a deductible is versus a co-insurance and a co-pay.
Yeah.
And deductibles are the amount that the patient is responsible for before the insurance starts
Mm-hmm.
picking up.
Mm-hmm.
And the co-insurance is a percent that the patient owes after that deductible is met.
All right.
And copays are when they have a flat amount due per visit.
Mm-hmm.
Typically, Medicare doesn't have copays. It's typically deductibles and coinsurance.
Right. Right. Yeah. There's well, this is getting off a little topic, but when they're looking at Medicare supplements, Medigap insurance, then the only plan that's very popular that has copays is Plan N. But we'll talk about Medicare supplements another time. Um, so the beneficiary, either, especially where a lot of the confusion and a lot of questions arise, is when they're brand new to Medicare. I don't market to brand new like pre 65, about to turn 65 beneficiaries, but I get a lot of calls, and I get more and more interest, which is really nice, from turning 65 or newly eligible, going on to Medicare Part B beneficiaries. And when I get calls from them, there's a whole lot of education process, and they're trying to discern what the best route is for them. Traditional Medicare, possibly a supplement to help fill in the gaps, or Medicare Advantage, Medicare Part C, which is zero premium, which is, that's kind of like, what, that's too good to be true, right? And there's just all this marketing towards Medicare Advantage right now. And so that is where I think someone like you can really break it down to dollars and cents, like literally, like what makes sense for you on your Medicare journey, because they're looking at it from a coverage standpoint, which I'm trying to educate, or I'm either trying to tell them, like, Medicare.gov has pretty much is obviously the resource for your general questions, but I want them to. I would love for them to understand uh, through our discussions that it truly matters when you make a decision and enroll into your path for paying for claims payments for the provider and for yourself. So
That decision is important, and you can only change it once per year, typically, unless there's an extenuating circumstance.
yeah,
So it's good to get a good grasp on the difference between the plans.
yeah,
When you talked about zero amount, I think where the confusion with that is on the Advantage plans, the beneficiary still needs to pay their Part B premium,
mm-hmm,
and and that changes every year. It comes out with a new amount.
yeah,
But whether they're on Medicare or Advantage plans, they're still paying that Part B premium.
yep, yep, yep. That's exactly correct. And so if you're brand new to Medicare and you're trying to try to go like the cheapest route, you still have to pay, the Part B premium. You still have to pay for 2021. It's 148.50, but it adjusts in increments every year. But it's obviously the U.S. government, so it's fairly stable. It's not like a huge jump in those. And typically, retirees or someone that's a beneficiary is either getting Social Security or they're getting some type of pension, or they're living off, they're living off whatever they built up throughout their working years. So that way, it's not something where it's a big burden on them. But there is a growing I don't know if you keep up with any of the extra benefits out there, like Medicaid has been growing pretty steadily as well. And do you service those built for that billing service for that program as well?
Yes, absolutely. After we bill Medicare, which is another really nice thing about Medicare, is they automatically send the bill to the supplement,
Mm-hmm.
whether it's a commercial plan or Medicaid.
Okay.
And so we will bill both insurances, and typically we don't need to bill the second one because Medicare sends that over.
Okay.
Whereas with Advantage plans, they don't bill the second insurance if there's Medicaid or a supplement to pick up the balance after the Advantage plan. That has to be manually done. And it's really important for the beneficiary to know that if they do have a co-insurance or a co-pay, some deductible what they owe, they need to know if they have a supplement or medical assistance
Right.
that's getting billed so that their portion responsibility is less.
Yeah. You know what just dawned on me right now is that, we discuss insurance, we talk about insurance, and there's a bad light on insurance, but this is an insurance-based program. Medicare and Medicaid it literally says on your Medicare card, health insurance program on there. And so it is, I think it's just like a big blanket in my head, or a big umbrella in your head, and it's covering and trying to help all these millions of beneficiaries, or Medicaid beneficiaries. So it's just like, once you get the view of how everything works from kind of the top down, it starts to make sense for uh, the beneficiaries, the policyholders, because I have a lot of healthcare professionals, and they understand the process, but then some of them are jaded as well from being on that process, because they gotta see maybe the pitfalls and all that stuff from being in the healthcare industry for years and years, and maybe there's some things that could be worked on. So I think it's just great that if you're able to discern and just be confident with your decision in the beginning. That's where I really want to make sure that the beneficiaries realize that initial enrollment period or when you get onto Medicare A and B, that's your right. You worked into the that and paid into that, and then if you decide on a brand that is gonna start paying for your medical services, uh, they're actually taking away. You're actually giving that right away. You're giving away your traditional benefits because you have to enroll in A and B. You have to pay for the Part B premium initially.
I
So.
just want to put out there quickly with Part A and B, that's kind of confusing to beneficiaries.
Mm-hmm.
Um, Part A is a benefit that you earn when you're working,
Yep.
and that's Part A pays for inpatient hospital and skilled nursing facilities and those types of services. But then the beneficiary has to elect if they want the
Right.
doctor to get paid in the clinic, and then that becomes what's known as Part B Medicare. So it's important that when in the beginning, like you said, to get it set up properly so that they're in both plans, that they elect to be in both plans.
Right. Yeah. And has the most providers, as far as I know, right? That are in the plan essentially, or in the program, because it was set up, 56 years ago. It's the
Mm-hmm.
it's the largest. Nothing, no private health insurance company, no matter how big they are, is bigger than Medicare, or is bigger than CMS. They basically develop the healthcare market for seniors and the disabled, and I think long-term care facilities wouldn't be around if Medicaid wasn't around, right?
Right.
So they develop these healthcare systems to provide a benefit, to provide Americans that with chronic conditions, and all the health services, all the different ways that you're getting your healthcare services, supplies, and stuff. That was all developed 56 years ago. So, I'm obviously sounding more biased, and I'll probably get comments in the below, but I like being able to just go back to something and be like, well, 56 years ago, this you can't talk to the insurance companies and just be like, oh yeah, they developed it. No, they didn't. you know.
Mm-hmm.
so, um,
True.
I guess we're almost done here, but I wanted to leave with, you know, so we've talked about the provider side. They need to understand, how the billing service works. They need to have a good service that is able to know the changes that happens with the regulations and how billing is supposed to be met for them, so that way they can get paid. We've talked about the beneficiaries in between that as well, and then also the EOBs, and how that's a little bit of a confusing piece of mail for them. So we're kind of discussing, Medicare and Medicaid as a whole. So since it's like the largest, essentially U.S. medical billing system under CMS, you know, what type of I guess medical claims do you see on a daily basis? Like what type of things that are uh, can you tell us about your day, that you might see about for beneficiaries, and just, go through what it looks like?
Yes, um, I just want to break down for the beneficiary when they do have the Advantage plans, or
Okay.
what's known as Part C Medicare, where they are opting out of Medicare. Those Advantage plans, they still in the background have traditional Medicare and Medicaid
Mm-hmm. Mm-hmm.
premiums they're paying.
Right.
And so the Advantage plan is working in conjunction with Medicare to, and they don't get those benefits if they're not paying for their traditional Part B
Right.
Medicare.
Right.
Um, the beneficiary, what we're seeing on a daily basis, you get calls all the time from beneficiaries, and we do too, where they're confused about their bill that they're receiving.
You might get more calls after this. Okay.
So we always try to coach them to find that explanation of benefits, and we try to go through what we're seeing on our end matches what they're seeing on their end, on what's due and what's the balance is.
That's so cool. Yeah, that's so cool. If there was a service out there that did that for beneficiaries, I mean, that would just lift an entire nation's headache, for sure. Because when those EOBs come in, it's just, I get the calls, you get the calls. They talk to them. They talk. The beneficiaries. You guys talk to it about your friends and all that, and you're just like, the whole lunch bunch doesn't know. So, um, but yeah. So like, when you do get the those questions and everything, like, typically, what are you seeing? Are you seeing that they haven't paid their deductible, or they're worried about the coinsurance amount, or what is it?
They're just confused why there is a bill or why there is a balance at all. And
Oh, yeah. Yeah, yeah.
why did I get this bill? Another thing is I was not at that provider.
Right.
And maybe they were at, like I reviewed before, at a hospital or another provider.
Right.
Like the providers send out lab work to labs. In
Right.
the lab will bill for it, and the patient wasn't at the lab, but their specimen was.
Oh, okay. So I guess I'm just gonna just clarify that, because I like to just break things down. So basically, when you go to a provider, they have other contracted services underneath that doctor's office, that they get either testing or help with the diagnosis for your particular health situation, right? And so
Right.
when they send it out, like your blood work, or they send it out, they're using other services. Is that what you're saying?
Exactly. And
Okay.
they're sending their specimen. The patient wasn't at ABC pathology,
Mm-hmm.
but their specimen was.
Yeah.
So it gets confusing because the patient or beneficiary didn't go to ABC pathology.
Right.
They went to their doctor.
Right.
And they're getting a bill from ABC pathology for
Yeah.
their balance. Medicare will pay 100% of a lot of lab services, but there's specimens that get sent that a pathologist read that the deductible and coinsurance apply to. So if you get a bill, that's why it's important to keep that calendar to see where you went on what day,
It's a good tip.
and compare that explanation of benefit and say, okay, was I
Yeah.
seen on
Right.
October 1st?
Right.
And could this be a result of that visit?
Yeah. Yeah. So keeping a calendar is super important. Just to be able to match up what you get on the EOBs. That's really good tip. That's a really good tip for everybody. So um, I know we've talked a lot about not just the providers and beneficiaries, and now that we're getting into the EOBs and everything. I want to really know what the people that are watching this, what you guys are thinking, about your medical bills. Obviously, there's sometimes an emotional response, right, to your health care, and I can't fault anyone for that, because it is your personal health, and you are trying to do the best you can with whatever situation that you're in. So we just want to provide more of these informative discussions and videos for you. So let us know what you all are thinking in the comments below, and hopefully you have some grace with it, because we don't want to start a discussion to where it evolves to where, you know, it's a negative, just negative responses, because we're really and truly trying to help out more and more people out there, whether it's the provider side, whether it's the beneficiary side, and just come together and be more like a forum to where people can just see where they're at, and we can meet y'all with your questions or concerns, and hopefully let you know, like, hey, this is a pretty simple thing. If you just do this, like have a calendar, or if you just, we have a quick and simple tip, like if you call 1-800-Medicare and say
Mhm.
agent a few times on the voice prompt, you'll get to a live agent. You know, we just want to give you some helpful tips and tricks along your Medicare journey, because, you know, like we've discussed in the past, it is a longer process, whether you're a provider and you're billing clients for 15, 20, 25 years, you know, and in a lot of instances, if you're a Medicare beneficiary, you know, you could be on Medicare for, shoot, 20, 25 plus years. You know, there's some beneficiaries that have been on it even longer, you know. So,
Absolutely.
but yeah, I want to wrap up the show, and I want to I really appreciate, you know, Bonnie from Billing Buddies coming on to the show. It's kind of a surprise for her, because we've been trying to get together for a little while now, right?
Yes.
So,
Our
but
coordinating our schedules.
that's right, right. That's right. So thanks so much for coming on the show. If you guys have any questions, or if you want to try to follow Bonnie, she's actually going to be on hopefully more of these discussion videos, interviews, or whatever you want to call them, and then we're going to address more topics this way, so that way we can help the Medicare community as a whole, and the providers and all the people involved. So thanks so much for watching, y'all. Take care and be blessed. All right, bye.